In 2022, 1 in 8 people worldwide were living with obesity. Since 1990, adult obesity has more than doubled, while adolescent obesity has quadrupled. This chart breaks down the 2022 adult population. Of the 2.5 billion people classified as overweight, 890 million were living with obesity. Both overweight and obesity result from an imbalance where energy intake from diet exceeds energy expenditure through physical activity. The 2022 data confirms that obesity is expanding across all age groups, with the rate of growth among adolescents now doubling the rate seen in adults. In 2021, higher than optimal BMI caused 3.7 million deaths from non-communicable diseases, including cardiovascular, respiratory, and neurological disorders. Obesity acts as a pathophysiologic driver, creating a bidirectional relationship with secondary conditions like diabetes, hypertension, and kidney disease. In youth, early-onset weight issues correlate directly to the premature development of type 2 diabetes and cardiovascular disease. This physical toll is compounded by psychosocial consequences, including social stigma and bullying, which impact a child's school performance and quality of life. Because children with obesity are highly likely to carry the disease into adulthood, they face a significantly higher lifetime risk for chronic illness. By driving multiple chronic diseases and increasing mortality across all age groups, obesity functions as a primary engine for the global burden of non-communicable disease. Despite its role in chronic illness, obesity does not present specific physical symptoms. This diagram outlines the body mass index, or BMI, which providers use to measure average body weight against height. Clinical classifications are based on the BMI scale. Class 1 begins at 30, Class 2 at 35, and Class 3 at 40 and above. Since BMI cannot accurately predict specific health risks alone, it is used alongside waist circumference. The CDC identifies increased risk for diabetes and cardiovascular disease when measurements exceed 35 inches for females or 40 inches for males. Because obesity lacks overt symptoms, identifying individual risk requires the proactive tracking of both height-to-weight ratios and waist measurements.